Hello everyone, welcome to sqadia.com, and in this section of our lecture Implantation and Early Pregnancy, we will talk about miscarriage. What are the different types of miscarriage? What is miscarriage? How it occurs and how it is managed. So, miscarriage is the spontaneous end of pregnancy before 24 weeks of gestation. So, if the pregnancy ends spontaneously before 24 weeks, we call it a miscarriage. Most common sign of miscarriage is vaginal bleeding. About 10 to 20% of pregnancies can end up in miscarriages. As the age of the patient or female increases, the chances of miscarriages increases also. Most common miscarriage occurs mostly in the first trimester of pregnancy. 3 out of 4 miscarriages are in the first trimester, first 12 months of the pregnancy. So that's the time when really precautions should be taken to save the pregnancy. Mostly the miscarriages are due to chromosomal abnormalities which occur in the first trimester and high after 45 years of the age. More than half of the pregnancies after 45 end up into miscarriages. So these are the two outcomes. If really little late in the time, if gestation period is little more, then the baby is you can see all the parts of the baby grown up and developed. So these are all the parts are developed. You can see all the parts. But in this case, mostly it's a clot with some parts showing up in this blood clot. So this is early stage of miscarriages, and this is little late stage of the miscarriage when the fetus is parts of the fetus are visible. Now, what are the different types of miscarriages? We have threatened miscarriage. If you see in this picture, this is the threatened miscarriage. Means there is a threat to miscarry, but the actual miscarriage doesn't take place yet. So it's threatened miscarriage. When you examine on a pelvic examination, the cervical os is closed. That's a good sign that the os is closed. It means this pregnancy can be saved. So there is a spotting, little bit of spotting. You can see blood coming out, but the cervical os is closed. So this is threatened miscarriage, or there is threat to abort, or there is threat to miscarry. This type of miscarriage can be protected or saved by symptomatic treatment, by rest, and if there is lower abdominal pain, some treatment to reduce the pain. And usually the best treatment for this type of miscarriage is the bed rest. You tell the patient that stay in the bed, don't move, and for a week or two, if there is a strict bed rest, usually the condition is recovered. Then in this type of miscarriage, it's called inevitable. Inevitable means you cannot avoid, it's unavoidable. So here, when the pelvic exam is done, the os is completely open. It means there is no chance this type of pregnancy can be saved. So here, os is closed, some os is open. Sometimes all the product of conception are completely aborted out. But in some cases, if something is left behind, usually they are removed by a procedure known as D&C, dilation and curettage. So inevitable miscarriage. In the third type here is incomplete. Incomplete miscarriage, os is open, product of conception, half of them are removed, automatically, spontaneously, but some products of conception stay inside the uterine cavity. So they have to be removed by dilation and curettage, D and C. So this is incomplete. This is miscarriage. Missed miscarriage, usually there is fetal death inside the uterus and mother is not aware of the condition. Usually there is some brown discharge from the vagina, brownish vaginal discharge. If there is no movement of the baby is felt, sometimes this is diagnosed when the female goes for the regular checkup and the ultrasound is done. The doctor tells there is no heartbeat of the baby. Really, really sad condition. But this is the missed miscarriage. The baby in utero death of the baby occurs. This is the complete miscarriage. If you see on the ultrasound, the uterine cavity is completely empty. There is nothing left inside the uterus. So it's complete miscarriage. Usually nothing is done for this type of miscarriage. Everything is out already. So this is left as it is. Now, what are the causes and management of the miscarriages? The most common causes of miscarriage is chromosomal abnormalities that leads to miscarriage in the first trimester, in the first 3 months of the pregnancy and first 12 weeks of the pregnancy. Then there are medical causes, there are endocrine causes. Endocrine causes, patients who have diabetes or thyroid problem, miscarriages are very common in them. Then uterine abnormalities, females with a problem like uterine septum, with the uterine ends or the neck of the uterus is not in the properly placed, or if the position of the uterus is not normal, all these can lead to miscarriages. Certain infections and chemicals also lead to miscarriages. Expectant management is if miscarriages already started, sometimes you wait unless all the product of conception are out of the uterus. In that case, once you do the ultrasound and nothing is inside the uterus, it means all the products are out, so nothing is required in that case. The medical management of the miscarriages is the treatment like drugs like misoprostol is used, which causes the removal of the product of conception. Since surgical management, as we talked before, is D and C. D and C, if you see in this diagram here, this is the dilator. Dilators are used to dilate the cervical cavity so the curate can easily go inside the uterus. So this is dilator. The word comes D and D. D is from dilation. You dilate the opening of the cervix and then put the curate in. So dilation and curettage, in which you remove the product of conception and lining of the endometrium is removed, so all the uterine cavity is clean of any product of conception. This is the lithotomy position, in which most of the gynecological procedures are done. Lithotomy, in which patient is laying on the back and the legs are bent at the knee and the feet are in the stirrups. Stirrups are these holders in which the feet are present. So this is lithotomy position. Lithotomy, dilators and curate. So this is the treatment of the miscarriage, in which dilation and curettage is done if the miscarriage is incomplete. In case of missed abortions, if the baby, depending on the gestational age of the baby or the fetus. Most of the time doctors try to do the normal vaginal delivery because the baby is dead and there is no heartbeat, so it's important to have normal vaginal delivery. So they give the medicines to dilate the cervix so pregnancy delivery can be easily performed. So this was the second section of our lecture topic, implantation and early pregnancy, in which we talked about the different types of miscarriages and their management. Thank you for watching sqadia.com.